April is Autism Acceptance Month, and that brings up questions about what autism actually looks like.
There is a whole spectrum, and it can be confusing for families. Often the signs could be missed for years, sometimes even into adulthood. We have Kristen McPeak live up at the University of Utah with what to look for and how to better support people on the spectrum. Kristen?
Yeah, we're in a classroom here, and I'm joined by Dr. Julia Hood. Can you tell me a little bit about what you do here at the University of Utah and outside of that?
Absolutely. So I'm faculty here in the College of Education, the Department of Educational Psychology, where we have both undergraduate and graduate programs, do a lot of coursework and training around autism spectrum disorders. I also am on the board of directors for Valley Behavioral Health. Used to work there for a number of years, overseeing their autism programming there. So very passionate about continuing that work with Valley. And then I also sit on the Autism Council of Utah board, where we're supporting individuals with autism, programs that are serving individuals with autism throughout the state. So very passionate about providing services and helping support services for individuals with autism in Utah.
And when it comes to those services, what are most people needing?
You know, I think it starts with the initial identification of autism. I think we have gotten better as a state, but people are still sometimes waiting over a year just to get an evaluation to get the diagnosis of autism, which can be really difficult for families who need services for their child.
Mm-hmm. When should people start looking to get diagnosed?
You know, we really recommend, and I think our pediatricians in the state have been doing an amazing job of doing autism-specific screenings at well child checks. And so what we're seeing is usually 18-month, 24-month well child checks. And beyond, the pediatricians have parents fill out a pretty brief checklist. It's usually the MCHAT or the POSI that asks a handful of questions about behaviors that could be related to autism spectrum disorder. If a family's checklist comes back as at risk or above, then they are typically referring the family out to get that diagnosis. So we see folks usually, I would say I personally see folks starting to reach out for evaluations around 18, 24 months, but then all the way through adulthood as well.
What are some of the signs that parents can look out for when their child might be displaying some of those?
Absolutely. So watching the developmental milestones, if child is meeting those developmental milestones. A big one that we see with children with autism, not always, but can be common, is delays in language development. So if your child is not developing language by that 18-month well child check, that's when you should be talking about that with your pediatrician, talking about possible evaluations to rule in or out autism, or if it's more speech related. I think also looking for social emotional reciprocity. Oftentimes we'll hear from parents when they come to an evaluation, oh, I thought maybe they were having hearing issues because I would call their name and they would never respond, when it was really symptoms related to autism, not an actual hearing issue. Or, you know, when you're playing games with your young child like peekaboo or things like that, are they giggling? Are they trying to do it back? Are they trying to get you to engage in those games? So some of that social emotional reciprocity in the language are the big ones we see. I think a lot of people talk about eye contact. Eye contact is definitely one of the things that we look for, but it's certainly not the end-all be-all for autism. Folks can have really well-modulated, you know, appropriate eye contact and still have autism spectrum, but you should also look for that as well.
Mm-hmm. And when it comes to getting that evaluation, what does an evaluation look like?
So here in the state of Utah, there are a number of funders that require specific standardized testing to get services if you do have a diagnosis of autism. So oftentimes the evaluation is through a psychologist who can administer those standardized testing tools. And so typically it's going to involve a thorough developmental, medical, social history that they do in an interview format with the family, with the parents. And then in-person testing with the child, depending on the age, can be some developmental probing, a test that we call the ADOS, the Autism Diagnostic Observation Schedule, and often also the ADI, which is the Autism Diagnostic Interview. Those are the tools that often insurance companies want to document that there is evidence of autism before they'll reimburse for services. And so typically you're doing a mixture of interviews with parents, in-person testing with the child, that then, you integrate all of that to determine if a diagnosis is warranted.
And just one last question. When it comes to that insurance, why is it so important to get that diagnosis?
Sure. Well, there are medical insurance coverage, there's behavioral health insurance coverage, and then autism insurance coverage is completely separate here in Utah. And so you often can't access the services that are found to be most effective for the interventions for individuals with autism without that autism diagnosis.
Okay. Well, thank you so much for explaining this all. It's not only just for kids that can get these diagnoses or evaluations. You're seeing adults coming in looking for some help and that kind of thing. So where can we go for more information?
Absolutely. So Valley Behavioral Health has a lot of resources on their website. Autism Council of Utah has great resources on their website. Looking at the CDC website for developmental milestones, all of those are great places to look.
Thank you so much. We'll send
Thank
it
you.
back to you guys in the studio.
Okay, thanks a lot, Kristen. Yeah, it's definitely interesting for a lot of people. And if folks want to check out that interview to get that information for someone in your family, you can scan that QR code right there, and you can watch ArcSat like anytime on your phone, tablet, or TV with our YouTube channel. We have highlights from our newscasts on the ARC Salt Lake YouTube page. Scan that QR code right there on your screen.